Hi, everyone. Good evening. If you are here for the neck, chest, hands, and beyond for M Beauty Clinic, you're in the right place. And it's not too late to actually share the link, the registration link to your friends and family who may be interested in joining us. And they can still really learn and maybe even win a raffle, but you'll
I
have
got a lot of patients today, and they were all interested.
they
I was
were.
so surprised. Yeah, one of my patients actually said, "Oh yeah, I'm gonna be watching you guys at the Zoom today." So
Yes. Well, I'll introduce this guy. This is my brother Rick. So those of you who are not yet M Beauty Clinic, patients, I'm Dr. Tess Mauricio, and M Beauty Clinic has been around for over 20 years. So this is already our 22nd year.
it doesn't look like it because you look at her, but
Thank you.
you will find out why she does look younger than someone who's had a business for over 20 years.
Yes, been a doctor for almost 30
Oh,
years.
30 years.
I know.
Oh.
It's
I
crazy. I
mean,
have a daughter
you do
who's
have
a
a daughter.
doctor.
Yes,
So yeah, so that's why.
that's true.
Yeah, so it's a family affair. My brother Rick is one of the RNs
Hmm?
here in our Miramar office and also our East Lake Chula Vista office, and then our other sister Angela. If you've seen some of our other webinars, I usually do it with Ange, but you're kind of
I'm
pinch
just
hitting.
substitute. I'm pinch hitting because she's a little bit under the weather. She has two smaller kids,
Yes.
so
Yeah, so okay, we're gonna get started because there's a lot of excitement. There's a lot of areas that we want to cover beyond the face. And I know there's a lot of people who are wondering what we do. The cool thing, if you are just joining us, thank you so much again for spending time with us here. If you are currently part of our M Beauty Clinic family, thank you so much for trusting us. Many of you have been with us for a really long time. We truly appreciate it. And I'm sure you guys are looking younger as time goes by, as you've tried our technologies as well.
the technologies that keep getting better and better. And I haven't seen the presentation, but we did just review it. It's 61 slides, and so I'm sure there's something for everyone.
Exactly, exactly. And this may be the year if you've never ever done anything, right? And then you're like looking at your neck, your chest, your hands, and you're like, okay, this is the year we're gonna do something. I'm gonna do something about it. More than ever now, you don't need to undergo anything invasive. Many of the technologies now have no downtime, no needles, painless, and you really can still see incredible results. So speaking of that, we'll get started.
And we do have people did send in questions
Questions.
also.
Those of you who sent in questions, thank you so much. They're excellent, and we will answer them here. All right. So we're
And
going
if
to
you
be
have questions also, don't be afraid to just send them in the chat. And we have Lisa here who's coordinating supervising the entire webinar. So just
exactly. And thank you. Special thank you to Lisa now because she really helped put this all together. And so thanks, Lisa. Okay, so let's get started. And what we're going to talk about, we have 61 slides. So we got to kind of go as quickly as possible. We're going to talk about ZERF. For those of you who have been watching my social media and social media in general, this is the latest that technology, or one of the first to have this incredible device to give you non-surgical tightening. We're going to go over soft wave. It's ultrasound. It's been around for a while, so we know it really works. IPL, Vidance time machine procedure, hair evolution. We're going to talk about your hair as well. And we're going to talk about something that we are near and dear to our hearts and our practice here, platelet-rich plasma, PRP, and platelet-rich fibrin matrix, your own growth factors to really reverse the hands of time. And then we're going to talk about some IV therapies that we offer here at M Beauty Clinic, which you may not be aware of. We really are one of the first aesthetic practices to offer longevity, sort of like full body wellness treatments in IV therapies. And we'll have Dr. James, my hubby, talk about that. And then carboxy therapy, which is incredible as well. You'll get to learn about. Okay,
That's it?
that's all.
Like,
That's all,
you sure?
guys.
You sure?
Anything else?
Anything else?
Okay, so let's
Hi
start
guys,
with
it's
a
me,
very
Cardi
special
B, and
person.
I'm here with
Oh,
Dr.
can you
Tess
hear
getting
her?
rejuvenated from head to toe. And this year they
Those
make
of you who
20
don't
years,
know,
so
this
Well, one of the
is
in their
perks
office. So
of
that means that she's
being
been
America's
practicing
favorite
over
dermatologist, and
20
we do
years.
have
So that's super
celebrities once in a while too, and they will fly in from wherever they are just to get the treatment, whatever treatment it is. A lot of the treatments that they do get are the non-invasive, no downtime procedure, but they know that it really works still.
exactly. And so the video that we're trying to get the audio is Cardi B. And this is her actually without any makeup. She came to see us in our Beverly Hills clinic, and she had us film this 20th anniversary greeting, and hopefully we'll be able to play it with the audio because it's so cool to hear her voice. Those of you who are Cardi B fans,
And it seems like the persona is different, right? Like the outside persona and how
well,
she
she
is. And
definitely is has an incredible personality. She's very, very sweet. And also, she basically is just herself. Yeah. Okay. All right. So,
Because you're saying your audio is off, you might not be able to hear it through here. So let us know if you can't hear this audio, okay, guys?
okay.
So let me see.
Just
Here we
play
go.
it.
Let's play.
Hi guys, it's me, Cardi B, and I'm here with Dr. Tess getting rejuvenated from head to toe. And this year they make 20 years, so in their office. So that means that she's been
Put in the chat
practicing
box if you
over
guys
20
can hear any
years.
audio
So
on
that's
this.
super experience. Now if you
Let's see. Can you hear any audio? But anyways, we'll have to move on because we have 61 slides. Hopefully you got to hear her, and she basically is just saying she's there and we can treat her from head to toes. And so that's kind of the whole concept of what we're going to cover today. So we'll put if you want to hear this, you can go on my Instagram account at Dr. Tess Mauricio, and you can actually hear her say
want
that.
to go to the
Okay.
Scally Rags, fine, but 20 years experience, I want to go to that. Hi guys, it's
All right. Okay. All right. Next, let's talk about ZERF. Anything off the face. This is the latest technology right now. We're one of the first in the US to offer this. This is what we call structural skin tightening, where we're able to target different levels in the skin and even down to the SMAS, the fibrous network of the skin. So this is the fibrous network that is beneath the skin, and this is the part that if you're going to have a neck lift or a facelift, the surgeons will have to surgically tighten. And when they do, then the skin kind of just glides with it. And we've never been able to really tighten that fibrous network before, but we are able to do that now without surgery with ZERF. And this uses multi-frequency radiofrequency. And what it does is regenerative in that it stimulates collagen production and then lifts and tightens the skin. And we can use it obviously for the face and neck,
it's amazing.
for the neck
It's amazing
especially.
after because what I tell my patients, and this is like our most popular treatment. I
Right
do
now.
maybe 3 to 4 a week
Mhm.
of this, and a lot of I would say 95% of them will do face and neck.
Mhm.
And what we have them do is do kind of like the skin, kind of like a skin check. You know, the skin check to see
Yeah, the snap
the
test.
snap test, and they see it right, like right there, right after we do the treatment. They'll see a difference already, on how tight their skin is, lifting already, even after just one treatment. And the cool thing with this is that we can control how high the energy is and how deep it goes. Some people, they will have concerns about, hey, Is this gonna melt my fat?
Mhm.
So then we'll be more careful, and then we won't go as deep. And there are people like, hey, just hit it. So
Right.
to tighten as hard as much as possible.
Yes, and you can see here that Kim K loves Zerf because different technologies in the past, even the ones that we've offered, had more pain. And so I think
A
what we
lot more pain.
what we all want is something that really works, has no downtime, no needles, no surgery, gives you nice tightening, nice collagen building, but is basically painless. And I'd say that Zerf for most people, facial treatment is not painful. The neck we do numb, and there's certain areas that may be a little, spicier than others, but everybody tolerates it, and everyone is very, very pleasantly surprised at how easy it is.
It's 100% tolerable. That is really it. Because like I said, we can control how high the energy, we can control how deep it is.
Yes.
And a lot of our patients, it's weird. It seems like they've already tried like Ulthera.
Yes, they've tried Ulthera, they've tried Thermage, or at least they've heard of these older technologies. This is basically like the 2025, this is the most advanced way to deliver energy in the skin, all the way down to the SMAS for structural tightening. And it's essentially
Yeah, and if you've ever done Ulthera,
or Thermage.
or Thermage, I mean, you will finish this treatment, and
Yes.
you're gonna want to come back.
Results. We already have patients who are doing their second treatment because they're so impressed with the results. Today, I've seen two patients, one who had it done maybe a couple of months ago, shocked and surprised at how much better she looks in her jawline, her neck, even her under eyes and facial volume, that she wants her husband. She had me print her before and after photos because she wants her husband to do it, because men who are scared of pain can really tolerate Zerf. The other patient today,
I can attest that men are scared of pain. Yes.
Yes, and then the other patient that I saw is actually her second time getting it done. She was so impressed, and she already had neck lifting surgery before, which didn't turn out well. It was horrible. They did bad liposuction. It left her uneven. It left like chunks of, like just extra loose skin in certain areas. So it was horrible. And throughout the years, we've been able to really improve her confidence. And we actually showed a picture of her 3 years ago and today, and we've been doing these collagen building treatments. She's had soft wave, she's had RF microneedling, and then she's had Zerf, and she couldn't believe that she looks so much younger now than 3 years ago.
And I had a patient that I did about a couple of months ago. And then I think 2 weeks ago, I see her and her two daughters, and they all deserve, because my patient, she said that I think people are asking if she was the sister of her daughters, and so now
Yes.
so her daughters decided, said, hey,
did.
we need to get those, we need to get Zerf also.
The two daughters told me, it's like, since their mom had Zerf, they're getting many more sister, is that your sister comment? So they weren't going to take it. So
right.
They got Zerf themselves. So you can see these are before and afters. It does take time for the result, even though immediately after you will see an improvement. Patients love that immediate result. But the concept is that radio frequency will rebuild your own collagen. So a big question is, how long do the results last? I tell patients this is a permanent reset of the aging of your skin. So this patient, after 2 treatments, you can see improvement in her under eyes, the cheeks, nasolabial folds, the marionette lines around the mouth, the jawline, the neck. That is now her new baseline. So it's like you reverse the aging of the skin. She looks younger. That is now where she's going to start the aging process again. And just like my patient today, who looks younger now than 3 years ago, if she continues to maintain, she really may never go back to how much older she looked 3 years ago.
Yeah, and then the collagen just keeps building and building.
And you can do it. You don't have to, wait. And I think being proactive is also very, very important. And if you can do this while you're just starting to have these issues, like starting to start folds, a little loose skin in certain areas here. Also, especially if you are on GLP-1 medications like Ozempic, those types of medications, you will lose volume, you will lose muscle, you will lose fat, and you will sag. And so what we found in our patients who are on those medications, if they're doing these types of collagen building treatments as they're losing weight and not wait until they're super saggy and they're super gaunt, these treatments will prevent you from having
From
those
reaching
issues.
that, reaching that really, really gaunt looking face.
Yes, and this is nice because you can see that even those really deep lines on her cheeks, those are really hard. Usually a patient like this will come in and we'd also recommend some laser skin resurfacing to really address those deep lines.
Maybe even a filler to
Yeah.
try to pull it.
Yeah, filler, look in the upper lip as well. You can see that the overall quality and texture of the skin, including the wrinkles, get better without fillers, without laser skin resurfacing, because collagen gets produced and the skin itself is younger. And you can see that the bands and the lines are improved as well in the neck. And of course, we're talking neck this time. The neck is tougher in a way because the skin there is a lot thinner. There's less fat. There's also no hair follicles there. So any kind of technology that we use, for example, if I was doing laser skin resurfacing on the face, we have to tone down and tune the lasers to a much more conservative setting so that the patients don't burn in the area.
The healing, because like you said, no hair follicles. It's really the healing that is the issue when it comes to the neck.
So this is an incredible improvement. Obviously, she could have gone lipo, face and neck lift, but a lot of people don't really want surgery. You know, those are options for everyone. You can always have, I tell my patients, you know, you can always have surgery in the future, but building your skin to a healthier, younger state, even if you end up having an excisional surgery, you will still be better off. Most doctors now that do facelift and neck lifts always address the skin. They would recommend a very deep laser skin resurfacing, radiofrequency microneedling, because they know a lot of the textural issues of the skin and wrinkles and sun damage are not improved with just pulling the skin. Next. Okay, so this is the actual treatment. This is Philip B. He's a very famous hair stylist. He has his own hairline, and he's already had different treatments for his neck. He's had laser, soft wave, RF microneedling, and he still has some loose skin here, also lost some weight. And so this is him having the ZERF done, and he's very comfortable. We didn't numb him at all. And it's just the applicator is applied on the skin. There's ultrasound gel. And then we're just kind of, you know, applying the radio frequency there. And he's not in pain. So if you are one of those who really were scared to do anything because of pain, this is the technology.
This is the one. It has a like an advanced technology where cold air is it's delivered the same time the energy, the heat is delivered.
Yes.
So it counteracts and makes it a lot more comfortable than anything really we've ever had.
Yeah, it's pretty amazing. We were really skeptical about this technology because the reps go ahead and keep playing it. The reps said that it was painless. And so
we're like, yeah, right.
How can something so painless work so well? But they were able to do it so that the delivery of radio frequency is paired with incredible cooling as well. And so it really is, and it really does work.
It's amazing. That's really the one word I can say. It is amazing.
Okay, next. And this is him immediately after.
So if I pinch the side that's not treated, you can see how it doesn't snap back.
So he's saying one side, right? One side.
He only treated the right side, and you can see the snap.
Oh, snap.
Versus the left side.
Snap test. Love it. Yes.
So you saw me treat just the right side.
So if I pinch the side that's not treated, You can see
This
how
side.
it
See
doesn't
that.
snap back. Now look.
And this is not fake. This is not fake.
Whoa.
It's not
Snaps
Photoshop.
right
It's
back.
not
Snap.
AI. This is
Oh,
really,
Yeah, you
snap.
can
Look at
message
this.
Philip on
The
Instagram.
snap
Snap,
test.
this is really
snap.
how it is.
Love
Actually.
it.
And our patients
Yes.
are amazing.
Okay, next. All right. So we'll talk about soft wave because if you're talking about arms, I just want to talk about soft wave and arms because soft wave is ultrasound and it's actually FDA approved for treatment of loose skin in the arms. So any of these technologies that deliver energy and then builds collagen over time can improve areas beyond the neck. And Softwave was able to really get FDA approval for that difficult area, which is the arms.
But you have to remember, it's skin. Like we have patients coming in, and and it's actually more fat than skin. So
Yes. So I think, that the key is really um, patient selection.
yes,
And so when you come in to the clinic, we will do a very thorough consultation and we will pick the right technology for you for your individual problems. And then, we'll make sure that it's the right thing for you. Because, like you said, sometimes it's more fat than
yes.
skin. But if it's skin, then soft wave and Zerf can really work well. And so, of course,
Combination with the other stuff that we have.
yes, there's so many. And then next slide. So Kim K, she's had everything that, so she's had Softwave. She loves Softwave. We only bring technology here at M Beauty Clinic that actually works.
Yes.
So
We get
that's
we
the
get
key.
approached by a lot. I mean, there are so many different machines from different countries, from the US, but Dr. Tess is very, very selective because first of all, we try it on ourselves to make sure it actually works and it's not gonna hurt us, not gonna have any bad side effects. So we only choose the ones that we feel like it really works, the best for our patients.
Next. Okay, next. So obviously we're going to talk about the neck. And for the neck, it really works great. Same concept in that it builds collagen. Next slide. You can see this is a lot of laxity. And as I was talking about, a lot of people who are going through using medications, GLP-1 medications, if you're on Ozempic or Ozempic-like medications, expect you will have sagging, you will have more wrinkles, but not if you are proactive and start doing these types of treatments.
Actually, if you're planning on going in GLP-1, you might want to pre-treat your skin.
Definitely. And that's what the best results that I've seen where patients did not have that loose skin, even though they've lost a lot of weight, are those patients who've done time machine procedures with us or, and other treatments to build collagen like soft wave. And they didn't have the expected sagging.
Yes.
All right, so let's talk about IPL because a lot of the things that happen in the neck, the chest, the hands, a lot of it are sun damage, pigmentation, specifically reds and browns. Intense pulse light is amazing. Let's show. This is a very simple treatment.
Well, who is that guy?
That's you.
Oh.
Of course, we're treating the face, but the same concept. We can use this for the neck, the chest, the hands, the arms, any area where you really have reds and browns.
Yeah, and the lighter you are, the more effective the treatment is.
You can see that improvement here in the chest. The chest is like the neck in that this is an area where you really want to have treatments done by experts. That's the one thing. Anything off the face, you really want to make sure that is treated by experts. The burns and potential complications, really the chances of that goes up in areas off the face because the skin is thinner. The skin doesn't respond the same as the face. And if you are being treated by novice people who don't understand that there's changes and they have to adjust the treatments, you can get into trouble.
Yeah, and we've actually seen people come here to
be repaired.
to be repaired, to be remediated from the side effects.
Exactly. So you can see this is very common if you've lived in California, you're your whole life and your fair skin. This is very common. The browns, the reds, on the chest, and just the intense pulse light alone, it's incredible how much better it looks. It looks younger because there's heating that happens as well. So even the texture, this kind of like fine crepiness in the skin that improves. And it does make you look younger. And the cool thing about IPL is that there is zero downtime. So you can come in, get it done, and dark spots turn a little darker for the first maybe few days, and then it just clears up. Yeah, and you can use it for, face, the neck, the chest. This patient,
This is my patient.
Yeah. She had photodynamic therapy.
Yeah.
Photodynamic therapy, we combine IPL with Levulin.
Put it back to the
and
previous slide.
yeah. And she, for those patients who have pre-skin cancers, if your doctor has told you you have pre-skin cancers, these are basically red, scaly, crusty areas that don't go away no matter what moisturizers you use. You probably have pre-skin cancers, and then we can use photodynamic therapy. And in one treatment, it can be very, very dramatic in removing sun damage, but also treating your pre-skin cancers, actinic keratosis.
I believe
One.
I think one treatment.
Mm-hmm. Yeah. There's a little bit of downtime with photodynamic therapy, but it's totally worth it. Okay, next. This is our favorite lasers right now. Anyone who has a little bit of downtime, and then this is the dual mode. This is an erbium YAG laser. So yes, you can apply laser. You can have laser skin resurfacing off the face. Has to be done carefully by experts. Again, this is an area where you can, get into trouble if it's not done right. And so this is an erbium YAG that, so obviously the laser is the one that I'm holding, and that's a smoke evacuator there because it automatically, instantly vaporizes old tissue, old skin. And so you really are removing old skin, and then your skin is going to heal and replace it with brand new skin. And we love this. In combination with our time machine procedure with platelet-rich plasma, exosomes, and you can see her face is a little red there because we also treated her face. But you can absolutely use this off the face. So the time machine procedure we already kind of talked about.
It's just a combination. It's a combination of everything that we have, and we keep updating as far as what the time machine procedure is based on the technology that we have. And so the time machine procedure that you had maybe 10 years ago is going to be different from the time machine procedure that you will get now.
That's a really, really good point. And also, one person's time machine procedure may not be the same as another person's time machine procedure. You can tell we have so many different technologies and devices, and depending on your skin type, the amount of downtime, what we're trying to achieve. Do you have deep wrinkles? Do you have acne scars? Do you have extra fat that we want to target? Do you have eye bags? So we can absolutely customize the type of energy and technology that we use for your particular time machine procedures. It's not a single device. It is what we call our signature regenerative combination protocol, and we combine the energy with platelet-rich plasma, and we'll talk a little bit more about that, and also platelet-rich fibrin matrix from your PRP, platelet-rich plasma, and we can use that for naturally volumizing your skin. And the results are amazing. So this, I actually was just at the American Academy of Cosmetic Surgery, and I gave a talk on power outcomes, and that's what we're here for at M Beauty Clinic. It's about power outcomes, and let's just focus on her neck here. There is absolutely no surgery that was done here. A lot of people do not believe that you can rejuvenate and tighten the neck without a neck lift. That is absolutely false. This is just the combination protocol of our time machine procedure. You can see that the crepiness, the extra skin, the sun damage, the deep wrinkles are improved after a single visit. Yes, that's a single
What's it like
visit.
A month after?
Yes,
Yeah.
out there. And it continues to get better.
Look at her eyelids.
Right. We'll concentrate on the neck, but yes,
Yeah.
look at everything there. It's so much better. And this is actually my patient's photos that she sent me because she was so impressed. She's from Norway and she comes here and she flies in for her time machine procedure. Next. And this beautiful patient is from Florida. So if you have relatives who want a power outcome, they can fly to San Diego or Beverly Hills, and we could do these types of treatments. And in one visit, you can really turn back the hands of time. And the last photo there is her own post. She actually posted that in her on her social media. How much better. And you can check out Rochelle Pena, and she's looking younger and younger. I mean, I told her she looks like a college student
I mean,
now.
it's amazing. And yeah, and the more time that goes, that passes by, the better the result is.
Yes.
Just because the collagen production.
This is absolutely, the time machine procedure is definitely one of my secrets. And those of you who are from San Diego and if you watch Fox 5 News, let me know when you done messing. A little that, a little this, then you put it through the test. For over
She
a
is the
decade.
nicest person.
Yes, she is. She's proud of her age. She's definitely in her 50s now. She just had a birthday. And that's platelet rich.
Something new, something fresh. Yeah, I'm super obsessed. Let me know when you done messing. A little that, a little this, then you put it through the test.
Off this week because it's her birthday week. But next week, then you'll get to see how good the results are of
And
her
platelet
time
rich plasma, we just take your blood, we separate the red part, everything else, and we isolate the plasma, and that's what we use.
Exactly. And that has your growth factors, decreases inflammation, and optimizes your natural ability to create collagen. And so, we've been in practice now for over 20 years, and we definitely have seen patients through many years. And if you do these treatments, collagen building treatments, and I tell my patients, if you listen to what we say, this can happen to you too. You can absolutely defy age through the years. You can age in reverse, where this patient at 2014, 2020, 6 years later, look absolutely
crazy, right?
younger than how she looked.
No
at
plastic
24.
surgery, right?
No plastic surgery, no face or neck lift. We didn't even do any fat grafting or anything like that. This is just her treatments in the clinic. And that is what we see with patients. And that's what I experienced myself. I will be 55 this November.
And
And
filter the license
DMV?
photos?
No.
Do they filter these or no?
Some people wish that they do, but no. You can do your own filter with the time machine procedure. So yes, that's 10 years later.
Oh, that's a good one. Time machine procedure filter.
Yeah, we should. We
That's-
should.
I think you should have that.
do that. Okay, let's talk about the hands. Another very, very, a telltale sign.
And there's a personal story from Tess because she gets treated. I treat her
Yes.
a lot on her hand. So I'll do some laser skin resurfacing, some mild ones just because it is thinner, and then I will inject the plasma, right, and tell how is it?
How is it? What do you guys think about my hand? Ta-da! And truthfully, my two areas that get me kind of self-conscious are my neck and my hands. 'Cause, it's like I've done a lot of work on my face and I really ignored my neck and hands until very recently. And so Rick's been trying to catch me up. So recently I've had some treatments on my face and neck. And that's kind of what we do. We do the time machine procedure, that concept for the hands. And you can see the before and after of the hands. The top is the before. You can see sun damage. You can see more of her tendons, her veins. And then after we did the time machine procedure, and it's amazing. The sun damage, the wrinkles, the volumization of the area, it's amazing. Take a look at the before and the after. So I posted this on my social media. What we did for this patient was we actually did a fat transfer. So you can volumize the hands, because one of the reasons why we end up seeing our veins and the tendons of the hand, especially if you're thin, is that we naturally lose volume. Just like in our face and our neck, the hands will lose volume as well. And so we need to volumize the area. And for this patient, what I did is I harvested fat from her hip, just under local anesthesia, and then I transferred it back to her hands for natural volume, and also fat has stem cell properties. And so that volumized the area. And then you can see, go ahead and play it again. We did a laser skin resurfacing on the skin of the hands to get, resurface it. And then we apply the nanofat and PRP on the hands. But for me, what Rick has done is injected platelet-rich fibrin matrix and PRP to naturally volumize it. I don't think you've done, we haven't done fat for my hands yet, but maybe one of these days. But maybe I don't need it because it's been doing well with PRFM.
And I don't know if you caught it in the video because it kind of stopped kind of abruptly, but you were injecting.
Yes,
Yeah.
there
There it is. There it
So
is.
that is actually micronized adipose, micronized fat that I injected there. So that I do that first. I volumize first, and then after that, then we do the laser, and then we apply the nanofat.
And the patient is awake, so there's no
Right. You don't have to be under general
yeah, not in general anesthesia. You don't have to worry about that. Patient's awake, and we have the Pronox to keep you comfortable.
Right. Okay, so for the neck, everybody needs to get this done. Jeuveau or Botox, basically. Botox for the neck band. So let me just talk about a little bit of anatomy for the neck, why it's necessary. The platysma, the band, the big neck muscle, strap muscle.
This one.
Right. See, look, iron.
That's
You
the-
can kind of see a
have
little
one?
bit showing.
I'm not skinny enough to have
Feel
that.
it. If mine are treated, that's why you don't see it. Normally, if I'm talking a lot, I I'm very, very
I do
expressive.
notice it a lot. It's because before.
Yeah, much
Yeah,
better because
yeah.
it got treated. But can't see it now. But the platysma, do that and then take a look at yourself. The platysma goes from your jaw bone all the way to your clavicle. It's giant. It's this big muscle here. And the edges of that is called the platysma band. And as you age over time, you will see it with muscle contraction. And that's also what ends up hanging. The ropey appearance of the neck hangs as the skin gets loose. And so because it's a muscle, we can treat it with Botox to relax it, to stop it from contracting. And when you do that, see, when I'm trying to contract it, just like if you get Botox or Jeuveau here, I'm trying to contract, I can't do it. The muscle's not doing that. And when that happens, you relax the platysma and you don't see the bands, and also you don't create and you minimize the appearance of the tech neck lines. And you can really make your neck look so much younger just with those injections. 15 to 30 units, usually 30 units is what I get. And it's a world of difference.
Yeah, it really affects a lot of women, the skinny women.
Yes, exactly. So if you are like looking at yourself and you're seeing those bands, come in here, 30 units, it's like magic. In the past, we weren't able to really address the platysmal band without surgery. Surgically, that can be addressed. They will go and make an incision, a cut here,
Really?
and then they'll
Just
find
for
the
that?
muscle. Yes, that's how they would treat it. If you were getting a neck lift, they'll do that, and then they'll sew down the muscle so that it can't contract. But we are able to do that. But obviously, the results aren't permanent, just like if you were getting Botox or Jeuveau for your face. But while it's working, it's magic. That's why my patients who've known me, who've seen me over the years, say my neck looks better now.
Well, especially
Because I talk all the time.
especially if you have an event,
Yes.
You know, coming up, maybe you have an anniversary
Or a
or a
wedding.
wedding, yeah, anything
Yeah.
like that, and you feel like, maybe just if you even just that one
And
time.
it's not very expensive because it's only 30 units
Mhm.
of Jeuveau or Botox, and within 1 to 3 days, it's gonna be amazing, already better, full effect 2 weeks. Next. And this is how it works. This is Maria Arcega done again. This is one of her things because she's, slim and she talks for a living and it pops out. She hates it.
Especially if you're trying to make a point when you're reading the news. Big crash. It's a
Yeah.
crash.
Yeah, it's not, some people like, oh, that looks scary. These are really tiny insulin syringes. Just don't get this done if you cannot tolerate any bruising at all. Sometimes it
Yes.
bruises, but
Well, I recommend anytime you do any injection, give yourself at least a couple of weeks.
Right.
If you have an event, like I said, if you have any event, this is an amazing
This
treatment.
is
But
amazing.
don't wait, until it's around one
So
to
it'll
two.
help the horizontal lines, and it will absolutely help the platysma. The other thing that we use this for is called the Nefertiti lift, which essentially I told you the platysma goes from the jawline all the way to the clavicle, and if you already have your jawline is no longer sharp and defined, the platysma is pulling that down more, like your jowls and this, and it blends it to the neck. So when you relax it, like key points in the jawlines injected with Jeuveau or Botox, it releases it and it actually causes a lifting effect on your jawline and it gives you a nice definition. I had that done as well, and you can see my jawline there. Pretty good. Good job. Good job, Rick. Good job, Ange.
I think Angela did that.
I think Angela did
that
Good
one.
job, Ange. Okay, next.
She does the easy ones.
So, okay, so let's talk about hair because it's very important. It's off the face.
Hair.
So important
Uh-oh.
is all my hair. Rick just treated my hair too.
That's another one of her insecurities is
I can't lose my
her
hair.
hair.
This is like my signature, and this is like my hair. This is the longest my hair's ever been. I keep going flip-flopping. I ask my patient, should I cut it? They're like, no. But then I think it's getting too long, but then, it's fine. Is it getting too long?
Yeah.
It's
Yeah,
getting too
thick,
long.
thick,
I need a
thick
haircut.
inches.
Chelsea, this is actually Chelsea. Chelsea from Adair Salon in Carlsbad. She is my hairstylist. She cuts my hair, and I've just been so busy, I haven't been able to go there actually. But she also has a history of alopecia areata, and she has thinning because she um, also is losing weight.
Mm-hmm.
And that's the other thing. If you're losing weight for any reason, or if you're under stress, or if you take any GLP-1 medication, type like Ozempic, you are at risk for losing your
No, you
hair.
will. I think you will.
Yeah,
Yeah,
you
I'm not
will
gonna think it's
because
risk. I think you will. Yeah.
so you can plan ahead before again you go on those medications, or at the minimum, don't wait until you've lost a lot of hair if you're on those medications.
Yeah, because these treatments
This
are
is
great
painless.
if you're losing hair. But if you've lost a lot of hair,
Yeah.
it's a little harder.
It's harder. Just like anything, prevention is easier. This is the Pro Deep laser, and it's painless to do this. And what it does is just like increases circulation, activates the regenerative process of your hair
It
stem
makes up your
cells.
follicles because sometimes
Mhm.
there's a program in there where your follicle, once you turn, I don't know, 30, 40, it'll just shut down. And so everything we're doing is just to try to stimulate, say, hey, wake up, wake up.
Yeah, and the next slide, yep, same. Where are
Whoa,
we?
this is me.
Yeah. So we can inject, this is nano fat, but PRP also from your blood can be injected. Many ways to kind of really activate the stem cells. And this is me. I'm a little out because I had nitrous and my face is red because I had the time machine procedure. This is the secret to why I look young. Next.
I love it every time after like at the clinic. She's like, what are you doing? I'm like, nothing. She's like, okay, let's go do
This
these.
but he hates it. That's why he runs away right away. So this is actually Chelsea Adair's before and after she sent us. So much better. I just saw her a few days ago, and it's amazing. And it works for men too.
No, I had a patient actually. I told her, I said, "Hey,
Next.
your hair looks nice," and I forgot that I actually treated her
Exactly.
with PRP.
PRP works,
Yeah.
guys. Next. So, next. Okay, that's what PRP looks like. So we'll draw your blood, we'll put it in a very special tube, and then we'll spin it out. But PRP is not just for aesthetics. It also you can use its anti-inflammatory effects for other things. So we'll bring my hubby now. Here, Abe, talk about this because my husband, Dr. James, is an anesthesiologist.
Doctor? Doctor?
Okay. Okay.
Here I am, I guess. Thank you for having me.
Yes.
Rick, you're doing a great job. I don't know. I feel bad kicking you out.
No. Good. You're good. You're doing good.
Get to break. Get to break.
Well, I think we talked about PRP a little bit earlier, but I just wanted to explain a little bit about what it is exactly. We're taking the part of your blood with the platelets, platelet-rich plasma, and we're taking out the parts that will cause bruising. It will cause irritation. That's the red blood cells. And if you look at the picture there, the bottom of that is the red blood cells. That's what's going to cause the bruising. We're taking that out. We're taking the top part, the yellow part, and making sure that the platelets are there as well. That is what we want. And that's where the magic it really lies. We're biohacking in a way because we're taking that part of your blood, which is normally inside your blood vessels. The only time it's ever outside is when you have a cut. And that's when the platelets get activated normally. But we're taking it out of your blood vessels and directly injecting it into areas that need this activation. And what is it? When the platelets activate, normally it's telling the body to heal some wound. If there is no wound, it's just going to regenerate. So
Right.
we use it in the clinic, and for aesthetic reasons, to regenerate and kind of turn back the time, the hands of time. But we also use it for tendonitis, in the elbows, tennis elbow, anywhere there's inflammation and ongoing injury, we can inject it into those areas and sort of stimulate the body, remind the body that it needs to heal. So we can use it for really anything. It's pretty amazing. So again, the ultimate in biohacking.
Yeah, and it's pretty cool because we were just in Beverly Hills this weekend, and you treated your college
My
best
college best friend, he had kind of torn something in his shoulder. He went out golfing, and he with no preparation, with no
And he's our
exercise
age.
before it. He's our age, and he tried to hit it like he was in college. You're trying to hit the ball 300 yards, and it's just not going to happen. You got to build yourself into it, work yourself up. But he tore some muscles almost a year ago, and he's still trying to heal. And I said, well, let me inject PRP in there. And he said, yeah, okay, I'll do whatever it takes. Immediately, when you find the right muscle, you find the right area, you inject the PRP into it, he immediately felt relief, and within 2 weeks, all gone.
Yeah.
And so he's so much happier. So
and those of you who don't know, James being an anesthesiologist, he also practiced pain medicine. And so if you have these things, because I just had like a couple of patients ask me about this, who've come in for other aesthetic reasons. They're like, hey, do you know about PRP and tendonitis? And she had a tennis elbow. And I said, yeah, Dr. James can do that. So if any of you are interested in that, James will take care of you. And you will do it also. One of the key things here at M Beauty is you can do it under nitrous gas, because it's not fun to have your areas of tendonitis.
yeah, you're taking an area that's already kind of injured, that's already inflamed, and we got to go right into those areas. So it's a little tender, but we know we got the right area when you feel it.
Exactly. So, but you'll be a little bit, more happier with nitrous than without next. And not every practice offers it. So we talked about platelet-rich fibrin matrix. It's from PRP, and this is how we naturally volumize areas that we don't want to use injectable hyaluronic acid filler. So for patients really here in our practice, it would be your under eye area. We've done this for James as well, and this helped his eye bags, the tear trough, which is the hollow area there. For the neck and the hands, it's really, really amazing because those areas, the skin is thin, and so you want to naturally volumize it. You want to give it some cushioning. So platelet-rich fibrin matrix or PRFM is incredible for those areas, and that's what I do for me.
And the best way to think about this as a natural volumizer, it's the blood clot without the blood. So it's just the spongy stuff
And
that
it's
keeps
all
it all
your-
together. It's all natural.
And there's
Yeah.
not any potential for like lumpiness, bumps, looking too full, looking too unnatural. So it's all yours or rejecting. Next slide. Okay, carboxytherapy. So carboxytherapy is kind of like an your skin is basically going to have higher oxygen. So it's like a hyperbaric chamber for the skin. So carboxytherapy in the past, you used to need needles. You have to inject carbon dioxide in the skin. So carboxytherapy means introducing carbon dioxide in the tissue, but we're now able to do it with a mask. So this is the mask, you apply it, you leave it on for about 45 minutes, and then it brings oxygen, it decreases inflammation, it increases circulation, and it brightens the skin, it moisturizes the skin, even after the first application.
Yeah, when you
It's
force
amazing.
carbon dioxide into the skin, the body reacts by pumping in oxygen into those very
It's those
areas.
boring biology classes.
Yeah.
Like osmosis, right? Is that the one?
This is what I
Boring,
love,
exactly.
though. That's a
Yeah.
boring to you, but fun to us.
All right, so we can use that mask for the face, for the neck, but we also can use it for vaginal area. And so this is the CO2 Lift V. Comes in a special kit, but the same concept. You can apply it on the outside and in the vaginal canal. And it's hormone free. And if you have issues like dryness, recurring UTIs, pain, itching, it can really help, and it can add to everything else that you're using. If you're using topical estrogen in the area, it really can make a difference. So ask us about this as well. And PRP can also be injected in the vaginal area to help with incontinence, pain, dryness, and we treat, it's called the O shot, and we treat those areas. I'll inject PRP in key areas, and it can really help in combination with this CO2 Lift V carboxytherapy. All right, next. And so basically, again, no needle, easy. It's at home. You do it yourself. So it's in the privacy of your own home. And it really just increases the health of your tissue, which is always good. That's why hyperbaric chambers, it's really getting to be so popular right now in longevity because it has so many great health effects. And speaking of overall health and longevity, Dr. James will talk about why we are huge believers in IV therapies. Specifically, we've been doing IV glutathione and vitamin C injections for so many years.
And we're
right?
so happy to offer these because,
Yeah.
I mean, when you're talking about longevity and when you're talking about rejuvenation, you're talking about staying young, we're really talking about taking ourselves at the cellular level. And when you're doing that, the two of the most important biomolecules that we have are glutathione and NAD. And what are they? Well, if you think about the body and how it produces energy, NAD is the pistons to the energy, to the engine that creates that energy. And glutathione is the protector of the cell at the cellular level. So what you're talking about is when you're reducing these levels, reduction in these levels is associated with all sorts of diseases of the heart, the liver, the kidneys, the lungs. So when you retain these levels, it's thought to support all of those things and to bring you back in terms of youth and health.
Next slide. Yeah.
Yes. So Alzheimer's disease, Parkinson's, Huntington's, you name it, heart disease, atherosclerosis, heart failure. All of these are associated with lower levels of glutathione and NAD. So,
And yes, so glutathione, it's produced by our livers and it's natural to our bodies. We need it. It is our most powerful antioxidant.
And whenever you hear about oxidative stress, oxidative damage, UV damage, glutathione is what reverses that damage. It's the antioxidant to the oxidative stress that we encounter every day.
Mhm. And we give it IV as opposed to pills because then you get the big dose fully and you don't have to.
There's no digestive breakdown. There's no other side effects. There's no other unwanted chemicals. We're giving you the actual stuff directly into your veins.
NAD. NAD. So NAD is really big in longevity right now. You can research it. We offer it here at M Beauty Clinic. And you would just say something about NAD.
Yeah, well, NAD is really, again, it's how our body needs it to produce energy. Without it, your metabolism is going to slow down. Without it, your body functions will slow down. Your brain needs it to function, to create its energy. So NAD is what helps your body extract energy from the food that you have, from the fuel that it has. If you have a lot of adipose tissue, you can't burn it without NAD. It is one of the most important biomolecules that we need in our body,
Right.
and we're giving it to you directly.
It's amazing. I get the IV glutathione and vitamin C regularly. I've had the NAD IV therapy, and I mean, it's really amazing. And I feel like that's a big part of why I don't, people think, oh, you're
Yeah,
youthful.
why do you have
right?
so
It's
much energy?
inside out.
Yes,
Okay,
exactly.
yes, but we offer that here. I just want to let you guys know. And I think that's it. We covered all of the information. Wow, you guys know more than most doctors in the world, I think, as far as technology. I'm so excited for all of you. So these are the specials. There's a special for ZERF with the nurses, face and neck. The regular is 2,500, it's 2,100. For just if you just want your lower face, jawline and neck, it's 1,100. It's totally worth it. The company says we're one of the top ZERF practices in the United States right now. Expertise matter when it comes to these types of treatments because depending on who's working on you, how many passes, their technique, it will matter for your results. And then for your hair, we have this incredible combo, the Pro Deep Laser, which is painless that you saw Chelsea had for hair and skin. We're going to add on an exosome after the Pro Deep treatment. And after the Pro Deep treatment, you have openings in the skin and it allows any type of compound to really penetrate in the skin and work. And we have incredible exosomes to do that, to really try to activate your natural regenerative process. IPL, amazing. That will improve pigmentation, redness, face, neck, hands, arms, any area. Glutathione IV, which Dr. James talked about. You get buy two and get one free with RN for any of these. And then finally, Ceravive, incredible. So if you've had a hydrofacial before on your face, the concept of really deep cleaning, and infusing incredible boosters and peptides in your scalp for scalp health, improving circulation, and then finishing off with red light. That is what you get with Ceravive. And you get buy two, get one free just for you to try it. And in combination with the Pro Deep XO for your hair, it's going to be amazing. And then we have raffles. We have PRFM. Someone's going to win a PRFM. You're going to be volumized and you're going to look younger. And then one of you will win IPL, Intense Pulse Light of either the chest or the hands. And that's a $400 value with the nurse. Those of you who stayed with us till now will be put in the raffle. And then we will contact the winners via email and also through our social media.
So good luck, everybody.
Yes, and just know, this is really cool. Let's stop talking. The way to get started is to quit talking and begin doing. There's so many things you can do. It can be just minor things, but if you are looking at yourself and you're something that you don't like, I can guarantee you we can help you. We offer free consultations, get educated, then you'll get a quote for whatever it is that we feel you need, and then you can decide and make a decision what you're going to start doing. And then
Okay, so
Q&A.
thank you for those who submitted your questions via email. I'll just go ahead and read it off for Dr. Tess.
Okay.
But since the neck
You
skin
probably
is
answered most
thinner,
of these.
yeah,
Hope
it
so.
probably did. I'm looking at this now. Since the skin is thinner on the neck and more sensitive, are the deep horizontal pec neck lines better treated with more fillers or energy-based devices?
I think you guys can answer this question now if you were listening. So I think the easiest way to address lines is a little bit of Botox or Jeuveau. It also depends on whether you have a lot of laxity. Any of the collagen building treatments like ZERF, soft wave, lasers, any of those can really improve tech lines. Just depends on what you want to do. But the combination, like we talked about, the time machine procedure can help. So anything that builds collagen will improve, but addressing the muscles with Botox is very important for tech neck.
And remember, the skin is a lot thinner and more sensitive there, so you got to know what you're doing
Yeah.
to make sure. Yeah.
Don't get injured, yes.
Okay, so I'm just going to combine the next two questions, which is what is the gold standard ingredient to look for in topical neck cream to treat that crepey or paper thin skin texture? And is it safe to use my current facial retinoids on my neck, or should I use lower concentration?
Yeah, so the skin of the neck is a lot more sensitive than the face, less resilient. And so you want to be more careful with retinols, acids in the neck. Mostly, you really need to put in more moisture. So ceramides, hyaluronic acid is really good in that area. And rebuilding collagen, so the peptides are really good in that area as well. Antioxidants to protect the skin from more oxidative stress. Those are really important. And speaking of products, Jan Marini has this Body TX product that is available, so you can use this for your whole body as well. But many of the products that you can use on the face, as long as it doesn't have retinol, glycolics, those types of actives can be used on the neck. And moisturizers for sure should be used on the neck. Sometimes the neck will need more because it doesn't have oil glands.
But no product can do as well
No
as any
product,
treatment.
absolutely. Do not, if you're like, oh, products, spend the hundreds and hundreds in products, just get one of these laser treatments or a little bit of Botox, and it can't match it. But products is good for maintenance, and also once you've done your treatments, it can optimize your results.
Preserve the results, exactly.
So for those who are starting to see the thinning on the neck, which one would you say would give the most bang for your buck?
It depends. This is why you need to come in and get a consultation, because we have to evaluate your particular neck. Any of the treatments that we've done will improve it. It depends on your skin type. It depends if you can do downtime. It depends on your budget as well, and so we have to be really be able to customize and personalize it.
Come
The
on in.
time machine procedure, usually that combo gives the best treatment in one single treatment.
And I think you just answered that next question, which is the most effective way to treat the sleep wrinkles and the sun-induced redness on the chest.
That's it. So a combo of probably IPL plus the Vidance laser skin resurfacing time machine procedure. So you'll have platelet-rich plasma injected in the areas.
So at what point should someone consider the hand fillers versus just topical laser treatments? Again, just for the hands.
Right. So for the hands, it depends on how much you can tolerate seeing your veins and your tendons, right? So for me, I know that, I get IV glutathione done. So the needle is already in my vein. And anytime I get it done, I know Rick hates it, but I'm like,
What are you doing, Rick? What are you doing?
My needle is there. I need to draw some blood. and turn that blood into my platelet-rich
It
plasma.
starts. It starts
Here-
as a glutathione. It'll start as glutathione, and then, oh, can I do my PRP? Oh, can you just do my time machine?
Anytime you already have a needle in your vein, if you're here for IV gluta, it is the perfect
But
time
to be
get
fair,
PRP.
though, it's because it's hard for her to find the time to have the downtime.
That's true.
Yeah.
Yeah. But anyways, that's why. So PRFM for my hands. If you wanted to, really, if there's a lot of volume loss and you want it to be like more instant, adipose fat is really the best filler for hands. I'm a big fan of fat for the hands, and that's done just under local anesthesia. It's not a big deal. There's no scars from the actual fat transfer, and fat has stem cell capabilities that also rejuvenate the skin.
Okay, so the question was, it was for a pre-question, a pre-webinar question, but we wanted to ask about treatments for the knees and the elbows as well.
So same thing, the knees, elbows, abdomen. We didn't really talk about the abs. If you have stretch marks, if you lose skin, if you're losing weight as well, all of those areas will lose volume. All of those areas will get more wrinkled and saggy. So any of the technology, ZERF, soft wave, if you want no downtime, if there's a little bit of fat there, or if there's more stretch marks in your abdomen, then radio frequency microneedling, which we didn't really talk about today as much, but the needles deploy in the skin and deliver radio frequency, similar energy as a ZERF. Radio frequency is delivered, but with the needles, and we can use that to tighten and rebuild collagen. And since there's already openings with the needles, we can apply the platelet-rich plasma. So that can be done for the knees, that can be done for elbows, that can be done for abdomen.
You're talking about the hardest working skin of the body, the knees and the elbows, and the very thin skin there as well. So you got to be careful.
It's right. The key is really to go to experts, and you want to be able to do it safely, but good enough that you will get power outcomes. Because you can also, if you go to other places and they're not so sure, you may get undertreated and you may end up wasting your time and money, and then you think these technologies don't work, but it's really very, very dependent on who is doing the treatments.
Okay, second to last questions. So we already talked about how to treat the dark sunspots on the hands, but the question is, which treatment would you say to do without causing excessive peeling or downtime?
So for pigmentation, IPL is the best way if you don't want downtime. You do need a series of treatments, but even after the first one, you should see lightening, and some of your dark spots may go away with a single treatment, but it is meant to be done in a series. If you do have about 3 to 5 days, then we can do the laser skin resurfacing. And the advantage of laser skin resurfacing over IPL is that you actually will get collagen building. So you also get improvement in texture, wrinkles. If you have acne scars, or if you have stretch marks, those things improve as well as pigment.
Yeah, IPL is good for pigment, and the time machine is good for all the other texture problems.
Right.
Okay, last question. So if I start a professional treatment plan for these areas, what does a typical long-term maintenance schedule look like?
So it depends. So most of the treatments that we talked about, besides Botox, is really a reset of the aging of your skin, which means you have a brand new, more younger, healthier baseline. So it's really up to you. If you never did any treatments again after a time machine procedure or a ZERF or a soft wave, you will be better off for the rest of your life because you reverse the aging of your skin. You now have a younger baseline. Now, if you maintain it as our patients have done, as I have done, you do continue to see improvement, so that you saw that patient where she looked younger 6 years later than her baseline photo. That is absolutely possible for everyone if you do the right thing and if you listen to us.
That's actually why we call it the time machine, because it's up to you. You can kind of turn back the clock as much as you want.
How much do you want? Okay, and that's it. So thank you all for joining us, and we hope to see you at our next webinar. Thank you, Rick. Want to say bye? And then Lisa, thank you so much.
That's her hand there. There we go.
And see you all at M Beauty Clinic. Book your consult, book your treatments now. Don't wait. Bye.
Thanks, everybody.